Hi. So I had something that was kind of a bummer happen yesterday, and that is I had a bleed from my lungs. So I figured I would make a little video today and share about that because I'm doing a bit better. I'm doing a lot better since it happened. Um, so a lot of times, people, like if I say, like I can't do this or something happened or blah, 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 because I had a bleed, sometimes people just look at me with like a kind of a blank stare, or some people ask me, a few people ask me, what is a bleed? Some people just say, oh. So I feel like there's not a ton of information out there on the web that's from a patient's perspective around what a bleed is. I feel like Anna and Isa Stenzel in their book, The Power of Two, I think it's Isa who has an episode. It's been a while since I've read that, but she has an episode of hemoptysis, which is another word for having a bleed from the lungs. It's more of the medical terminology, and she explains, what it was like to have kind of smaller ones and some bigger ones. And for me, I have had a number of bleeds in my lifetime. The first time it happened, I was just in my first year of college, and they were smaller at first. And then the episodes sort of got bigger. Well, actually, maybe I should just describe kind of what happens at first before I go into that. So what happens is I cough up blood. So, and it's not just like what we call streaking, which is like sometimes if people get sick or they have a cold or have like a more intense pneumonia or bronchitis, when they cough, or if your throat's really sore when you cough, sometimes you can actually, there'll be like a little bit of blood and mucus, or like streaks of blood and mucus. And so that's not what I'm talking about when I say I have a bleed. When I say I have a bleed from my lungs, I mean, the cat's jumping up to give her input. I mean that I'm coughing up straight blood. And it's usually, sometimes there'll be like a clot or something in it. With some of the bigger ones, I've had that happen. And it's, sometimes it's just like usually bright red, and sometimes it comes very quickly. It's definitely a scary thing. I would say in general it's kind of less scary when it happens now, especially if it seems like it's a controllable smaller amount. But sometimes it comes really fast. And so, like I said, I started bleeding that first year or so in college. And it escalated, so they got bigger to the point where I needed to have a procedure done. It's called a BAE, so a bronchial arterial embolization, and that's where they go in. They actually go in through, I think it's the femoral artery. I should have looked up this stuff before I started, but it's a artery. No, it's a vein because it goes towards the heart. A femoral vein, and they go in with like a scope, and they go up, and they do all this in interventional radiology. There's a special kind of doctor that does this procedure. And so you're in radiology, so they can kind of see inside, see what they're doing. and they go up and because they can see with radiology, they kind of look for an area that looks like it might be bleeding, and sometimes it's very obvious, sometimes not so much. And they go in, and there's a couple of different things they can do. Some procedures, they'll insert a coil. Some, it's more of, it was described to me as kind of like a plastic-like material. And I forget what the other material is they use, but and they try and like block off the vessels where they suspect the bleeding is coming from. So I've had to have this done twice. The first time, it was definitely very scary. There is a risk when they do that surgery that they can also the vessels that go up in towards the lungs are also some of the vessels they have to go by or through or something. Some of the vessels that give blood supply to the spine. Now my dog is giving her 2 cents. I don't know if you can hear her. So anyway, there's risk involved with that procedure. And you're also, there she is. It's not done under, I swear they wait until like I'm on the phone or video to act up. But it's done, it's not done under general anesthesia because they need you alive, yeah, it's good to be alive. They need you coherent at certain points to be able to communicate with them to just make sure, they're not going in a place they shouldn't. But they do give you a drug to kind of help sedate you a little bit. And I forget what the one is called. Maybe it's Versed or something. They also give you the drug to kind of like make you forget stuff, I think. Sorry, I know that's not very technical. Anyway, they try and make sure you're as comfortable as you can be. But actually, when I was getting my second one done, I actually couldn't have that at first because my oxygen had dropped, and they couldn't give it to me until my oxygen had stabilized. So that was pretty scary. And the nurse that was working with me at that point just, really helped me through that. And she helped me to focus on her eyes and stay with them and help me to breathe. And my oxygen came back up, and then they were able to give me something. And it's scary or painful if I'm asking for sedation because I often try and do things as much as I can without it. So anyway, that's the BAE. So that's something they can do. They can also do that in emergency. Well, I shouldn't say obviously because maybe it's not obvious, but it's more challenging to do in an emergency situation because the blood is coming fast and it's harder to work with and that kind of thing, but it can be done. Ideally, you would want to address it before something becomes an emergency situation. So anyway, I had a BAE done once, and then that helped. I think it was for about a year-ish. Maybe it was closer to 6 months. But then I started bleeding again, and it was smaller amounts at first, and then it became more, and I got to the point where I actually needed a second BAE, and the doctor explained that it's a little bit tricky with me because my vessels, particularly on the left side where I tend to kind of feel things more, are very like windy, twisty, sort of contorted. So he said it's a lot riskier to go into that area because they have to use smaller pellets, and then there's the risk that it will go through. And but the second time, because it happened again so soon and it had escalated to what was really scary, actually the amount of blood that I brought up, I was in the hospital when it sort of broke and the scariest amount happened, thank goodness. Yeah, maybe that's a whole nother video, but I literally had like a doctor look at me and just say, I'm so sorry, and look terrified and like shoot out of the room. So yeah, that's a whole nother video probably if I choose to do that. But basically it's scary. It can be scary. I got to a scary amount, so it was time to do another one. So the good news is that since that second BAE, I didn't bleed. I don't know, it might have been like, I want to say a year-ish, but I can't really remember. I'm sure I do have it documented, but and since then I haven't had one of the bigger, more scary episodes or the biggest episodes. There are points where it has gotten progressively worse, and there are points where when it does happen, it feels really scary, honestly. Like it just, the blood's coming fast, and sometimes it's hard to kind of catch my breath or certainly talk. Blood is a great thing to have within the blood vessels, but not necessarily without the blood vessels or outside of the blood vessels, because it's very abrasive in the body and in the body's tissues when it's not contained. So I often, the throat will often be sore after just from having the blood in there. But I also, the lungs get really inflamed because you have blood in places, again, where it's not meant to be. So many times in the recoup period, like after a bleed, I might be more asthmatic. I might have trouble breathing. If I'm already kind of more compromised lung-wise, it can certainly and has certainly sent me into a place where I've needed to be hospitalized, just because of the nature of what it does in the body, the inflammation, and sometimes it's just too much for the lungs to clear if the bacterial load is high. This can happen at any time. Yesterday it happened while I was outside walking home on my own. It's uncomfortable, especially when it happens in a public place, or especially if I'm on my own, because obviously, I should stop saying obviously because maybe it's not obvious to people, but I don't want to be, coughing up blood, spewing out blood in public. That can be, like, I know kind of what's happening, but of course it can be very scary for people who see it and don't, especially if it's a bigger amount. So just for the sake of not scaring the public, it's good if it doesn't happen or it's good if I'm not in public when it happens, but obviously because it can happen anytime, I just said obviously again, it's not like something I can predict. Sometimes I do feel sensations, like I'll have some pain in my lungs or something where it feels like, I don't know, I think I might be on the edge, but sometimes you have those sensations and then, nothing specific happens. Sometimes, especially for the bigger bleeds, I'll feel like a pop sort of in my chest or my lungs. Sometimes it will feel kind of like a release, but then then everything tightens down, which is probably part of the body's protective mechanisms, but is usually kind of uncomfortable. What else? I think, basically it's scary. When it was happening more often, I at one point described it like I felt like I was, like a ticking time bomb, sort of, because I never knew when it was going to happen, and I never knew if the next time it happened would be like a time I would have a bleed out, or which is like when the bleeding comes and it's uncontrollable, or if it would be the time that I would spiral down. And so it was scary. I feel like when things were like that, I feel like I don't necessarily feel like that as much anymore. I have more history and time with it, and it could be really bad at any point, but I also have experience with enough times of it happening where I've seen how it stops, even times when it was scarier and it didn't seem like it was going to. And I know there's things that can be done. It is good that I live in close proximity to the hospital. I have some more comfort around that because I feel like I could get there relatively quickly if needed. I've had discussions with the particular surgeon and doctor who would work on it if it was an emergency situation when I was back in Rochester. I haven't had those same conversations here yet. One thing that was started and is something that the doctors do out here when a bleed happens is they get you on real high dose of vitamin K immediately. So that started for me yesterday. And we also hold off on any kind of chest PT that I normally do multiple times a day, and any kind of medications that might be more abrasive. So the hypertonic saline or if I'm on an inhaled antibiotic at that point. So we kind of wait until the body has had some time to heal, the lungs have had some time to heal, and then we start to reintroduce it slowly. The thing is, you don't want to wait too long because you also want to help clear things if there's things in the lungs that have made that bleed happen in the first place. The trick is sometimes it's not infection that makes that happen. Many times it is, but sometimes it can be something like an abrasive medication, which I think is actually what happened for me yesterday, given just what I'm feeling in my body and what's going on. So, given that I did have a bleed yesterday, I'm actually doing really well. I'm very tired. I didn't sleep through most of the night because I was coughing a lot, so that happens a lot after a bleed, but I'm actually breathing better than I am many times after a bleed. So that's good news, and I am going to start reintroducing some chest PT and also the one medication that I'm on later today after I've had 24 hours of the high dose of vitamin K. If there's any other questions or thoughts or anything you want to ask about the patient experience of what it's like to have hemoptysis. Obviously, I'm only one patient. It can look a lot of different ways. But if you have any questions about that, you can go ahead and just post them in the comments, and I will take a look and see what I can do about answering. I welcome, any question. For me, if people are curious, I would rather have them ask, and then if I can't answer or it's something I'm not comfortable answering, I will tell you that, and I won't. But I, welcome any question that you have. Not being someone who hasn't experienced having it, I don't know what the questions would be or what people may or may not want to know. So I hope that was informative, and for those of you that had questions about what the heck is a bleed, what is she talking about, I hope that I've helped to clarify that a little bit, and mostly also just help you to feel more comfortable about asking and or just putting some awareness out there about one of the aspects of what can happen when someone has lungs that have cystic fibrosis. So, okay, bye for now.